Who are physical therapists? Physical therapists are movement experts who optimize quality of life through prescribed exercise, hands-on care, and patient education. Therapists teach patients how to prevent or manage their condition so that they will achieve long-term health benefit. Physical therapists examine each individual and develop a plan, using treatment techniques to promote the ability to move, reduce pain, restore function, and prevent disability. In addition, physical therapists work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyle.
Where do physical therapists practice? Although many physical therapists practice in hospital, more than 80% practice in outpatient clinics or efficiency patient rehabilitation facilities, skilled nursing, extended care or subacute facilities, homes, education or research center, school, hospice, industrial or outdoor occupational environment, fitness center and training facilities.
Types of physical therapy. Each type focus on different problem. The first one is geriatric. Geriatric physical therapy focus on the unique movement needs of older adults. This includes treatment for conditions such as osteoporosis, balance disorder, Alzheimer, stroke, uh, joint replacement, and many more. The goal is to help restore mobility, reduce pain, and increase physical fitness. And there is neurological physical therapy focus on neuro condition and impairment such as uh, Alzheimer, spinal cord injury, stroke, multiple sclerosis, and many more. The treatment plan to achieve the highest level of autonomous function for living independently as long as possible. Physical therapy teaching to adapt visual balance, muscle loss, impairment for activity daily living.
Cardiovascular and pulmonary physical therapy focus on helping individuals who suffer from cardiovascular and pulmonary condition, such as heart attacks, chronic obstructive pulmonary disease, and pulmonary fibrosis. The goal of this subspecialty is to increase endurance and improve functional independence. Pediatric physical therapy focus on the unique needs of infants, toddlers, children, and adolescents. Early detection is desirable when a child experiences problems that inhibit natural movement and learning. Physical therapy is used for children suffering from disease or injuries, including acute injury, birth defects, developmental delays, genetic disorder, example cerebral palsy, head trauma, limb deficiencies, muscle disease, and orthopedic disabilities.
Physical therapists use therapeutic exercise, modalities, and treatment to help alleviate pain, regain stretch and range of motion, master proper body mechanics for balance and flexibility, and improve gross and fine motor skills. Physical therapists can treat a wide variety of medical conditions, depending on their specialty. Some conditions that can benefit from this type of treatment are cardiopulmonary conditions such as chronic obstructive pulmonary disease or COPD, cystic fibrosis, and post-myocardial infarction. Hand therapy for conditions such as carpal tunnel syndrome and trigger finger. Musculoskeletal dysfunction such as back pain, rotator cuff tears, and temporomandibular joint disorder or TMJ. Neurological conditions such as stroke, spinal cord injury, Parkinson's disease, multiple sclerosis, vestibular dysfunction, and traumatic brain injuries. For pediatric conditions such as developmental delays, cerebral palsy, and muscular dystrophy. For sport-related injuries such as concussion and tennis elbow. Women's health and pelvic floor dysfunction such as urinary incontinence and lymphedema.
Benefits of physical therapy. Depending on the reason for treatments, the benefits of physical therapies include 1. Pain management with reduced need of opioids. 2. Avoiding surgery. 3. Improved mobility and movement. 4. Recovery from injury and trauma. 5. Recovery from stroke or paralysis. 6. Fall prevention. 7. Improved balance. 8. Management of age-related medical problems. 9. A sport therapist can help an athlete to maximize their performance through strengthening specific parts of the body and using muscles in new ways. And 10. Healthcare provider or physical therapists can advise individuals about the benefits specific to their personal medical history and their needs for treatment.
Physical therapists are guided by their own code ethical principles. Thus, they may have any of the following purposes: promoting the health and well-being of individuals and the general public, emphasizing the importance of physical activity and exercise, preventing impairments, activity limitation, participatory restriction, and disabilities in individuals at risk of altered movement behaviors due to health factors, socioeconomic stressors, environmental factors, and lifestyle factors, providing interventions or treatment to restore integrity of body systems essential to movement, maximize function, recuperation, minimize incapacity, and enhance the quality of life. Independent living and work ability in individuals and groups of individuals with altered movement behaviors resulting from impairments, activity limitation, participatory restriction, and disabilities, modifying environmental, home and work access, and barriers to ensure full participation in one's normal and expected societal roles.